So, welcome to week 2 in section 2 of the text. We're going to look this week at chapters 4 and 5, talking about the nervous system and the actions of drugs. One of the things that I think is important to understand is the whole concept of homeostasis, how our body and brain tries to stay in balance, and when we are using drugs or alcohol, we are throwing the balance off. And our body and brain continually try to keep that balance going. Very important to understand neurotransmitters and the effects that they have, and particularly the effects they have on addiction, and how every drug of abuse will mimic a natural brain chemical. When we stop using the chemical, then our brain and body try to readapt to not having that. And that's what we call post-acute withdrawal. And that's a period that can be very uncomfortable for a lot of people. Talking about the effects of drugs on the brain, I'm not a big fan of memorizing all of the parts of the brain, but it is important to understand how they all work together and how drugs affect them. In chapter 5, a really important thing to look at is the categories of drugs found on page 98. And I'm just going to go over there for just a moment. On page 99, you'll see at the top of the page a diagram showing the different types of drugs: stimulants, hallucinogens, cannabinoids, depressants, opioids, psychotherapeutics, nicotine. So every drug falls basically into one of these categories. That is an important thing to recognize. Also, the nonspecific or placebo effects of drugs. You can't underestimate the power of thought on the effects of drugs. I worked at one time in a methadone program, and a client was put on a 30-day detox. And by week 2 of the detox, he was feeling extreme physical distress and was complaining to the nurse at the window. And the nurse decided to look and see what level he was at. And it was discovered that the detox had never been started, and his dose had not changed at all. But in his mind, he was detoxing, and he was feeling all the effects of detox. So understanding the placebo effect is very important. And also the mechanisms of tolerance and withdrawal. As you remember from the section on understanding addiction, and we talked about the DSM-5 criteria, tolerance and withdrawal are two of the symptoms that we use to identify substance use disorder. So those are very important to understand. So we'll see you in the discussion. Be sure to do the quiz, and I will talk to you again next week. Bye for now. Welcome back. We're at section 3 this week, and we're looking at uppers and downers. We're going to be looking at both stimulants, depressants and inhalants, as well as medications for mental disorders in this section. Stimulants are drugs like cocaine, methamphetamine, and as you can tell from the title, what they do is they stimulate the brain and give a person like an adrenaline rush. We'll look at the history of these drugs and the effect that they have on the body and brain. Also looking at the depressants and inhalants. In this case, we're not looking at one of the major depressants, but we will look at things like barbiturates, benzodiazepines, um, anxiolytics, which calm anxiety, and sleeping pills that help people to sleep. We'll look at the effect of inhalants. Inhalants are often a drug used by young teens who are looking to experiment with getting high, and they can have very dangerous qualities. I worked at a program with a young man who, as he came into the program, clinically was considered borderline developmentally delayed. Prior to using inhalants, he had been an honor student and had literally kind of destroyed brain cells with inhalants. The medication for mental disorders are probably different from any other type of drug that we talk about in this class, because that's actually one drug that there's sometimes difficulty in getting people to continue to take. People seem to want to stop those because, number one, they can have side effects that are uncomfortable, but people start thinking it's not really doing anything for them. So there are times when, by law, people even have to be required to take that drug. Uh, so read the three chapters, 6, 7, and 8. Join again with the discussion, do the quiz, and keep working on the abstinence assignment. And I will be talking to you again soon. See you next week.